Hi everyone, thank you for being here today. We have Dr. Sarah Cody and James Williams from the County of Santa Clara here to address that have just completed in the second anniversary of the first case of COVID-19 being found in the county, and James will address an update to the public health order testing ordinance. So without further ado, I'll turn it over to Dr. Sarah Cody.
Thank you, Roger. Good morning, everyone. It's good to be here. In a way, so today is just really an update to tell you where we are. And the reason to come today is that it is the 2-year anniversary of the first time I came before you to announce a case of COVID. As you may remember, on January 31st, 2020, we announced our very first case of COVID in a Santa Clara County resident who had just returned from Wuhan. And what a road it's been in the last 2 years. Since that time, we've documented over 275,000 cases of COVID, and we know that's an undercount. And now over 2,000 people from our community have died of COVID. While that number, our rates of death from COVID are lower than in other places in the state, in the country, nevertheless, it is difficult for me and I think for all of us to imagine that we've lost so many people from this pandemic in our community. So now, as you know, we're in our fifth wave. We've been through many Greek letters, and we're now in the midst of Omicron. But we do have some good news to share, which is that we are on our way down. We're on our way down the down slope. I'd say we're about halfway down, not coming down as fast as we went up, and our road has been a bit more meandering. Now, just under 12% of those that we test are positive, which is down from 17%, which is good. And our case rate, again, is about half of what it was at the peak. So what have we accomplished in these last 2 years? Well, just a bit over a year ago, of course, vaccines became available. And since that time in our community, people have really stepped up to become vaccinated when they're eligible and to become boosted. We now have 83.5% of everyone living in our county is vaccinated. So that's not just the eligibles, that's everybody, 83.5%. Of those who are eligible, we're just under 90% vaccinated. And almost 64% of people who are eligible to be boosted have gotten boosted. So this has given our community a tremendous level of protection, and it has buffered many of the harms from COVID. So this has been challenging, and it will continue to be challenging, but there are other signs of hope ahead. And one of those, of course, is that we know so much more than we knew 2 years ago when we announced our first case. I think in the months and perhaps years ahead, what we can anticipate is that we will continue to see peaks and valleys. We won't know, of course, how often those peaks will come and how difficult or relatively easy those peaks will be, but we do know that they'll come. But we have our layers of protection and we know what to do. We have vaccinations, we have boosters, we have testing, we know when to test. We know that everyone needs to stay home when they're sick. We know that how incredibly important ventilation is, that outdoors is much safer than indoors. And we know when things are bad that we need to avoid gatherings, particularly large gatherings. So we know all of this, and we've been practicing this for a long time. As we go forward, though, we have to remember that how important balance is, particularly because we've all worked so hard for 2 years, and we need to balance the harms of COVID with many, many other things that we need as people. There's also hope, I think, from new drugs coming on the horizon, so that if someone is sick with COVID, they can have a much better chance of recovering. And as those new drugs come and as they're scaled and more available, that will also protect all of us. I think the other thing that I think that we're going to see going forward is a transition of sorts, where many of the activities that we've been doing as government, the need to provide mass testing and mass vaccination to ensure that everyone is reached as fast as possible, I anticipate that will transition back to the way that we traditionally work, where you would go to your health provider traditionally for vaccines and testing, and that our role at the county and in the public health department will be more our traditional role, which is ensuring access and removing barriers for people who are the most vulnerable in our community. So that's where we are today. I'm going to turn this over to James to give some details of a revision to the testing order that's been in place for quite some time. James.
Thank you, Dr. Cody. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Wanted to provide an update on our September 16, 2020 COVID-19 testing order issued by the health officer. And this is, I think, part of what Dr. Cody was just talking about, the need to ensure easy access to COVID testing and robust infrastructure. We've had that order in place for some time, obviously, and today Dr. Cody's issued an update to that order. The update doesn't make radical changes. It does, however, bring the order up to date with what we now know about COVID testing. So, for example, it will continue to be a requirement in Santa Clara County that large healthcare providers, such as, for instance, Kaiser, Stanford, and PAMF, continue to provide easy access to COVID-19 testing to their patients. It will continue to require that testing be provided to those who have any symptoms of COVID-19, as well as those who are close contacts. But in a change from the current order, instead of requiring routine surveillance testing for essential workers, it now will require testing aligned with the guidance from the California Department of Public Health, as well as from the County Public Health Department. In addition, it allows healthcare providers to use both antigen and PCR testing. The prior order was only PCR testing, and that reflects the fact that the guidance has also shifted there. For instance, it's recommended to use antigen and not PCR testing in order to end isolation early. Providers must provide access to testing within 24 hours, and that's regardless of whether someone comes in person or requests a test by phone or electronically. And although they can provide that testing access within 24 hours through another facility that they run or operate, they cannot refer the patient to a different healthcare provider or to a publicly run county testing facility. For PCR tests, the results have to be provided within 72 hours. And if there are any delays in that, the healthcare providers have an affirmative duty to inform us of those delays and what they are doing to resolve them. And finally, healthcare providers will be required to provide an updated notice to patients of their rights under this order. Some of you may already be familiar with some of the posted notices for testing access at these facilities. Those will need to be updated, and in addition, providers will have to provide affirmative information via email and other communication channels to their patients of the rights of those patients under the revised testing order. So again, most of the requirements remain the same, but we've made these adjustments to reflect the latest testing recommendations and guidance, the availability of reliable antigen testing, and to really ensure that we're building a long-term sustainable infrastructure where those in our community can get timely and appropriate access to COVID testing directly from their primary care providers. Thank you.
And with that, we'll move on to take questions from the media. Just heads up, we will move on to Spanish and other languages after the question and answer session. If you can please identify who your question is for, and we will start with Bay City News.
I would San Jose Spotlight now.
All right, San Jose Spotlight then.
Well, so is this something that residents can look to and feel more hopeful? Are we coming to the end of the
The question is, are we coming to the end of the pandemic? And as I was saying, what we can anticipate going forward is that we will continue to have more peaks and valleys. So no, the pandemic is not over. It's a question for us about how we manage the pandemic individually and collectively as we face the waves that will come.
Mercury News.
Sure, so the question is, have we sent any warning notices or letters to healthcare providers regarding the testing order? And if so, who? And the answer is yes, we have sent warning notices to all of the large healthcare providers in our county. When I last spoke with all of you and encouraged folks to let us know of any concerns with access to testing, we did indeed receive concerns from many members of the public, and we are following up on those. And we will continue to follow up on those. It is very important to us that residents in our community have access to basic primary care that they deserve and need. And one piece of that is COVID-19 testing. And we will follow up, including follow up with implementation of these revisions.
Who are those healthcare providers that you sent letters to?
It's all of the large healthcare systems in our county, so that includes Palo Alto Medical Foundation, Kaiser, Stanford, you know, all the hospitals, El Camino Hospital, so forth.
NBC.
Dr. Saracodi. Since this is a 2-year sort of retrospective,
Mhm.
a lot of us were probably here on that first day that you did that. You were trying to make sure people didn't panic and overreact. Looking back, knowing what you know now, anything that you think you should have done differently, that might have made a difference in the long run?
So the question is, looking back retrospectively over 2 years, is there anything that I might have done differently? I would say that exactly 2 years ago today, on January 31st, we knew so little. We knew so little. And I hope that we communicated effectively and truthfully what we knew and what we didn't know. What we have tried to do as a community and as a county is to share with you all in the news media so that you can share with our community what we know, what we don't know, and what we think it means and what we think people should do. So I think I feel pretty good about how we have adhered to those values during the pandemic.
KPIX, this is for James. Tomorrow is the deadline for vaccines and boosters for those who work in high-risk settings, particularly firefighters. There have been a couple of dozen holdouts. What is your plan to enforce that deadline tomorrow, and also what are the consequences for those who don't get it?
Sure. So the question is regarding the order requiring that personnel working in higher risk settings receive their booster shots. In other words, be up to date on their vaccination. And again, these higher risk settings are places where there is a lot of contact with more vulnerable populations. That includes our medical first responders, which in this county includes many firefighters. And the question was, what are we doing to enforce that order? We are working with the various agencies that are affected. We will be proactive in reaching out and making sure that folks have complied with the order. But I've got to tell you, based on the questions that we've received and the communications that we've had with the agencies that employ a lot of personnel who work in these settings, they appear to be pretty on top of it. And we're pleased that a lot of folks have gotten vaccinated as a result. And we very, very much hope that people will go ahead and get their booster shot It's very simple to do. The access is readily available. It is so protective for themselves, for their families, for those that they serve, and for our broader community. And that's why that order is in place.
KTVU?
The consequence is the same as for any other health order violation, and we'll be following up with organizations if needed.
KTVU?
So the question was, do the consequences include termination? The obligations of the health order are on employers and their organizations. How the organizations handle the deployment of their personnel. For example, how they may be able to reallocate folks to work in different roles, or accommodate them otherwise, or be unable to accommodate them in some circumstances, is something for them to handle as part of their employer-employee relationship. That's not governed by the health order. So our requirement is simply that those people working in these roles be up to date on their vaccination. How that is achieved within the context of a specific employer is up to that employer.
KRON? 26?
How would you compare our current status of COVID-19 today with a normal flu season in comparison of hospitalization and infection?
The question was, how would I compare COVID right now with a flu season? I was just looking this morning at some national data and indeed some worldwide data, and we're still at the place where the mortality rates from COVID are still significantly higher than the flu. So if you look at everyone who's infected and then who dies, COVID's worse. This is not, quote, just like the flu, which is, of course, why we continue to manage it differently and deal with it differently. But I want to emphasize again, hopeful signs. The good news is that we know so much more about COVID now than we did 2 years ago. We have vaccines that are very, very effective at protecting all of us from severe illness and death. And then we have all these other tools that we can layer on to ensure that we're protected. So that's very good news.
KCBS?
You mentioned a wind down of some of the county services. Any timeline that you can give us to that?
This is a question about a, quote, wind down of county services. What I want to say is just looking out into the future over the next many, many months. So there's no particular timeline to this. But we're at the beginning of a year, we're marking an anniversary. I want to give you a sense of what's to come in the months ahead, is that I foresee that there will be a transition where the baseline amount of vaccinations and testing will be primarily in people's medical homes, and that the county's role will over time transition back to our traditional role, which is ensuring that those with barriers to access who are otherwise vulnerable get the services that they need.
Any sense of when that process might begin to become apparent to residents?
I think just over the months ahead. So I don't have a specific timeline about that. I just want to share that that's the thinking going forward as we part of learning to live with COVID and manage COVID.
Saturday Spotlight?
So does that mean any of the county testing sites have closed, or do you not know what they're going to close?
Right now, we still have quite a bit of testing available, and you can always go to the county's site, scfreetest.org, and see where testing is available. The purpose, of course, of this revision to the health order is for our healthcare providers to understand that they also need to rededicate themselves to making testing available for their patients.
Mercury News?
Yeah, going a little bit back to this announcement today, why are you changing the guidelines? What is it that has happened in the last month that has made you want to tweak them? Is it that
So the question is, what's the reason behind the revision to the testing order? And I'll make a couple comments and then invite James if he would like to as well. There's a couple reasons. One is, yes, the county has been carrying a disproportionate burden of testing throughout the pandemic by a very wide margin. Number two is that the situation has changed and the guidelines has changed as far as who we recommend getting tested and how often, and we wanted our health order to be updated to reflect that. And three, the tests that we had, the diagnostic tests for COVID that were available when I issued the first testing order have also changed. And so we needed to update the order to reflect that. For example, we didn't have antigen tests when we issued the initial testing order.
NBC?
Dr. Cody, at some point, and maybe it was because so many counties were doing so much, at some point it seemed as though the county became sort of in lockstep with the state and CDC. Is there any policies given, say, unique factors in the county where the county differs in the way it's dealing with the situation from the CDC or the county or the state, or is everybody pretty much on the same page all the time?
So this is a question about the county's policies and practices aligning with the state and the CDC. As much as possible, I like to align with the state and the CDC because it's simpler to communicate to the public, and we want to reduce confusion for the public. Because at the end of the day, we want people to understand what's the risk, what does it mean, and what do I need to do, and make that as simple as possible. That being said, our role here, and certainly my role, is to ensure that we protect the population as best as we can. And so there certainly have been times when we have felt that the state or national policies are not protective enough, and then we have stepped in to have revisions for our local policies.
We'll go final question, KPIX.
I'm sorry, you had a quick.
Just saying, and are there any that you can use an example now?
At the moment, you know, we have our testing health order. Some other counties have a similar testing health order, so that's different. Our masking is aligned, and I think that's about it. So at the moment, we are pretty aligned. Yeah.
KPIX for final question, please.
San Francisco is easing some of the mask orders. Any timeline, any light at the end of the tunnel that you can offer for us to get back to a little bit of normalcy?
Right. So regarding masking, as I mentioned, we are looking at where we are, like how widely is COVID spreading, how much of a risk is it creating, and what layers of protection do we need to either recommend or mandate. And so, of course, masking is one of those that we're looking at and evaluating, but I can't tell you right now what's ahead for masking, because it's a little bit difficult to tell exactly how fast we're getting out of this Omicron wave.
Thank you, Dr. Cody.
Hola, ¿qué tal? Muy buenos días. Mi nombre es Ricardo Romero Morales. Soy oficial principal de información pública para el Condado de Santa Clara. Esta mañana, aquí en el Condado de Santa Clara, la doctora Sarah Cody acaba de anunciar que el día de hoy se celebra el segundo aniversario, o marca ya el segundo aniversario del primer caso anunciado de COVID-19 aquí en el Condado de Santa Clara. Esto quiere decir que ya van 2 años desde que se detectó el virus de coronavirus aquí en el condado de Santa Clara, lo cual es equivalente a aproximadamente más de 275,000 casos de COVID-19 aquí en el condado de Santa Clara y más de 2,000 muertes aquí también en el condado de Santa Clara. 2 años después, estamos ya en esta quinta ola de casos, la cual sigue circulando en nuestra comunidad. Y estamos viendo en estos momentos que en esta quinta ola de casos los números de contagios está empezando a disminuir, mas sin embargo venimos bajando de una cantidad muy alta. En estos momentos nuestra tasa de casos está más o menos aproximadamente a la mitad de donde estaba cuando esta ola de casos estaba a su máximo, que fue alrededor del 10 de enero de este año 2022. En los últimos 2 años hemos aprendido mucho acerca de este nuevo virus, coronavirus, también conocido como COVID-19. También hemos avanzado, hemos no solamente avanzado en tener pruebas de detección de COVID-19, también hemos aprendido cuáles son aquellas capas de prevención para seguir previniendo contagios en nuestra comunidad. También ya tenemos una vacuna, la cual está ayudando a prevenir enfermedades severas, hospitalizaciones y muertes causadas por el COVID-19. Y también tenemos ya las vacunas de refuerzo, que son para aquellas personas quienes ya recibieron sus vacunas iniciales al menos 5 meses si recibieron Pfizer o Moderna, o 2 meses si recibieron Johnson & Johnson. También en estos últimos 2 años hemos ya vacunado aproximadamente más del 83% de la población total que vive aquí en el condado de Santa Clara, y aproximadamente el 60% de la población ya recibió sus vacunas de refuerzo. Al igual, sabemos que esto ha sido 2 años muy difíciles para todos y cada uno de nosotros, no solamente aquí en el condado de Santa Clara, pero también alrededor del mundo. Sabemos que lo que viene, seguiremos teniendo estas altas y bajas en las cuales estaremos aprendiendo más acerca del COVID-19. También sabemos que vamos a estar teniendo o esperando más variantes que pueden que circulen en nuestro condado, al igual que el resto del mundo. Más sin embargo, estamos en un mejor lugar que donde estábamos hace 2 años. Hace 2 años no teníamos acceso a pruebas, no teníamos el conocimiento que tenemos hasta la fecha del día de hoy. Más sin embargo, también sabemos que en estos momentos estamos en un momento de transición. Estamos en un momento donde a partir de estos ya 2 años, estamos en un lugar donde más del 83% de la población está vacunada, y es por ello que se está tomando la decisión de que la mayoría de los esfuerzos de vacunación, al igual de hacer las pruebas de detección de COVID-19, van ahora a ser también redirigidos de regreso a los proveedores de atención médica de cada persona. Mientras que el condado se sigue enfocando en remover aquellas barreras que existen en el acceso a estos servicios para aquellas poblaciones de nuestra comunidad quienes han sido más afectadas por el COVID-19. Es por ello que el día de hoy también se anunció que hemos estado haciendo una revisión a la orden de pruebas de aquí del condado de Santa Clara. En esta nueva orden o estos nuevos cambios que se están anunciando el día de hoy incluyen que cada proveedor de atención médica está obligado a proporcionar la prueba de COVID-19 si las personas cumplen cualquiera de los siguientes requisitos. Número 1, tienen algún síntoma de COVID-19. Número 2, ha estado expuesto a una persona que ha dado positivo a la prueba de COVID-19. O número 3, se le exige o recomienda que se someta a una prueba de detección de COVID-19 según las pautas del estado o del condado de Santa Clara. Si se encuentra en una de estas categorías, debe consultar con su proveedor de atención médica para que le haga una prueba de COVID-19 dentro de 24 horas. Si se encuentra en una de estas categorías, ya sea que su proveedor de atención médica tenga la opción de proveerle con una prueba PCR o una prueba de antígeno en estas 24 horas. También en esta orden se avisa que las personas tienen el derecho de recibir sus resultados en un periodo máximo de 72 horas. Si este periodo máximo de 72 horas no es cumplido, los proveedores de atención médica deben de avisar al condado de Santa Clara para que el condado de Santa Clara esté al tanto de lo que está pasando en estas facultades. También a aquellas personas que sean negadas a una prueba de COVID-19 en su proveedor de atención médica pueden reportar a estos personas o a estas entidades quienes no están proporcionando una prueba de COVID-19 y lo pueden hacer a través del sitio web scccovidconcerns.org. También, como prueba adicional, estas entidades médicas tienen que asegurarse de que puedan mostrar estos nuevos datos de la orden dentro de sus facultades institucionales de cada locación. Una vez más, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública del condado de Santa Clara. And we will now go ahead and transition to Vietnamese with New Han. Thank you.
Kính thưa quý vị, cách đây đúng 2 năm, vào ngày hôm nay, hạt Santa Clara đã phát hiện ra trường hợp nhiễm COVID đầu tiên. Và sau đó, các lệnh y tế được đưa ra vào tháng 3 để mọi người phải ở yên trong nhà, shelter in place. Trong 2 năm vừa qua, quận hạt đã có rất là nhiều biện pháp để bảo vệ cho cư dân, bảo vệ cho sức khỏe để mọi người để được bình yên. Và trong số đó thì quận hạt đã làm đến hơn 7 triệu lần xét nghiệm cho cư dân. Có đến gần 300.000 người đã bị nhiễm COVID-19 và quận hạt của chúng ta đã có đến hơn 2.000 người đã qua đời vì COVID-19. Tính cho đến nay, những biện pháp này sẽ vẫn tiếp tục được quận hạt giữ ra để bảo vệ cho sức khỏe của cư dân. Tuy nhiên, quận hạt cũng kêu gọi những cơ quan bảo hiểm y tế hãy tiếp tay với chúng tôi để đưa ra những xét nghiệm, những tiêm ngừa đến cho cư dân để bảo vệ sức khỏe của mọi người được nhiều hơn. Và hôm nay chúng tôi xin được thông báo về quyền được các cơ sở y tế, bảo hiểm y tế cung cấp dịch vụ xét nghiệm COVID-19 cho cư dân. Theo lệnh của viên chức y tế hạt Santa Clara, cơ sở bảo hiểm y tế của quý vị bắt buộc phải cung cấp dịch vụ xét nghiệm COVID-19 cho quý vị nếu có trường hợp nào sau đây xảy ra. Thứ nhất, nếu quý vị có triệu chứng COVID-19. Thứ hai, nếu quý vị có tiếp xúc gần với người đã xét nghiệm dương tính với COVID-19, hoặc nếu mà quý vị đã được yêu cầu hoặc giới thiệu đến xét nghiệm COVID-19 theo hướng dẫn của tiểu bang hoặc của quận hạt. Các cơ sở chăm sóc y tế không phải là nơi xét nghiệm định kỳ cho học sinh từ mẫu giáo cho đến lớp 12, nhưng phải cung cấp tất cả những cái loại xét nghiệm khác theo yêu cầu hoặc giới thiệu cho học sinh từ mẫu giáo đến lớp 12. Nếu có một trong những trường hợp trên xảy ra, hãy yêu cầu cơ sở bảo hiểm y tế của quý vị cho xét nghiệm COVID-19. Cơ sở bảo hiểm y tế của quý vị có thể hỏi trường hợp nào đã xảy ra cho quý vị, nhưng không thể đòi hỏi bằng chứng. Nếu một trong những trường hợp trên xảy ra và quý vị muốn được xét nghiệm, cơ sở bảo hiểm y tế phải cung cấp dịch vụ xét nghiệm COVID-19 cho quý vị ngay, theo xét nghiệm PCR hoặc là kháng nguyên trong vòng 24 giờ. Đây là quy định cho dù quý vị yêu cầu được xét nghiệm trực tiếp hay là từ xa. Những yêu cầu có ràng buộc trên mặt pháp lý này sẽ thay thế cho tất cả những thông tin quý vị nhận được từ cơ sở bảo hiểm y tế của quý vị về việc giới hạn xét nghiệm. Nếu có trường hợp vi phạm, vui lòng gửi khiếu nại về các quy định trên đây cho www.scccovidconcerns.org. Và nếu mà cần những thông tin về những dịch vụ giúp đỡ cho COVID-19, xin quý vị hãy lên trang sccgov.covid19. Và chúng tôi là Như Hạnh, nhân viên truyền thông của quận hạt, xin cảm ơn tất cả. Và sau đây, là thông báo của tiếng Hoa. Xin cảm ơn tất cả.
大家好，我是圣塔克拉拉县紧急行动中心的安全。自从2020年1月31日在县内发现了第一例的新冠确诊病例，至今已经2年。在这2年当中，有27万人，超过27万人确诊，超过2000人因这个病毒而死亡。因此，在这个2周年之际，再次提供一些县内的疫情现况。目前县内超过83%的居民都接种了疫苗，而有超过90%符合条件的人打了疫苗，也有超过60%以上的民众也接种了疫苗加强剂。经过了这2年的疫情，我们也更加了解如何的防疫。维护社区的安全，像是打疫苗、戴口罩、保持室内的通风，生病的时候留在家里面，还有室外比室内要来的安全。在经历了5波的疫情之后，我们看到县内疫情开始趋缓，但是在将来我们可能会持续看到疫情的起伏。圣塔克拉拉县认为现在是时候将新冠相关的检测和疫苗接种交还地方医疗提供，交由地方的医疗保健提供方来继续的执行。根据圣塔克拉拉县卫生局长的命令，只要您符合以下任何的条件，您都可以要求您的医疗保健提供方为您做新冠肺炎的检测。而且您不需要提出证明：第一是您有新冠肺炎的症状；第二，您曾经接触或是暴露于新冠肺炎确诊的人，或是根据州或县的指引要求或建议您做检测。只要您提出要求，您的医疗保健提供方就必须在24小时内为您做新冠肺炎的检测，这是规定。如果您接受了 PCR 的检测的结果必须要在72小时之内通知您。任何跟新冠有关的讯息都可以上圣塔克拉拉县新冠肺炎的网站，网址是 scc.gov.org/covid-19。最后，祝大家新年快乐，万事如意，虎年吉祥。Thank you.
Magandang umaga sa lahat. Ako po ay si Jimbel Batuampo, Public Information Officer ng Santa Clara County. 2 taon na ang nakaraan mula ng unang kaso ng COVID-19 sa Santa Clara County. Sa kabuuan, mayroon ng 270,000 COVID-positive cases at lampas 2,000 ang namatay sa county. Ang responsibilidad para sa COVID-19 testing ay inilipat na sa mga healthcare provider. Ngunit patuloy pa rin ang serbisyo ng ibang testing sites ng county. Ang County ng Santa Clara ay napalabas ng abiso sa inyong karapatan na tumanggap ng COVID-19 testing mula sa inyong healthcare provider. Bilang kautusan, ang opisyal ng pangkalusugan ng Santa Clara County, ang inyong healthcare provider ay kinakailangan magbigay sa inyo ng COVID-19 test kung natutugunan nyo ang alinman sa mga sumusunod ng pamantayan. Kayo ay may anumang mga sintomas ng COVID-19, kayo ay nalantad sa isang taong nasuring positibo sa COVID-19, o kayo ay kinakailangan o inirekomenda na magkaroon ng COVID-19 test sa ilalim ng mga patnubay ng estado o county. Ang mga healthcare facility ay hindi kinakailangan magbigay ng regular na surveillance testing sa mga estudyante sa K-12, ngunit dapat magbigay ng lahat ng iba pang mga test na inirekomenda o kinakailangan para sa mga estudyante sa K-12. Kung kayo ay napabilang sa isa sa mga kategoryang ito, dapat kayong humiling sa inyong healthcare provider ng isang COVID-19 test. Ang inyong healthcare provider ay maaaring magtanong sa inyo kung kayo ay napabilang sa isa sa mga kategorya sa itaas, ngunit hindi maaaring mangailangan ng katibayan. Kung kayo ay napabilang sa isa sa mga kategorya at humiling ng isang test, ang inyong healthcare provider ay dapat magbigay sa inyo ng isang COVID-19 test, PCR o antigen, sa loob ng 24 na oras. Ito ay ang patakaran kung kayo ay personal o remotely na humiling ng test. Ang inyong healthcare provider ay maaaring magsabi sa inyo na pumunta sa ibang klinika o testing center na pinapatakbo ng parehong healthcare provider sa loob ng county o sa labas ng county kung nasa loob ng 10 milya ng inyong tahanan. Kung kailangan para matiyak na matanggap niyo ang test sa loob ng 24 na oras. Ang inyong healthcare provider ay hindi maaaring gawin pa man magsabi sa inyo na pumunta sa isang lokasyon na pinapatakbo ng iba pang organisasyon, kabila ang mga pampublikong testing sites ng county. Kung kayo ay nakatanggap ng isang test na batay sa laboratorio, halimbawa PCR, dapat kayong tumanggap ng inyong mga resulta sa loob ng 72 oras. Ang mga legal na umiira ng mga kinakailangan ay nangingibabaw sa anumang iba pang mensahe na natanggap ninyo mula sa inyong healthcare provider tungkol sa pagiging limitado ng test. Mangyaring sumiti ng reklamo kung ang patakarang ito ay nilabag. Kung ang inyong healthcare provider ay nabigo na matugunan ang mga pamantayan sa itaas, kayo ay may iba pang mga reklamo o inaalala tungkol sa COVID-19 testing, mangyaring ipagbigay alam ang mga ito sa Departamento ng Pampublikong Pakalusugan ng County sa www.sccovidconcerns.org. Maraming salamat.